So the next one we're going to be looking at is the teaching suspected cancer. Approach to suspected cancer. Now, in this particular case, you're an FY2 in a GP surgery. A third-year medical student wants to learn how to assess a patient with suspected cancer. Teach a medical student how to assess and manage a patient with a possibility of a cancer. That is our task. So we're going to use a normal teaching approach that in your introduction, use your first name. My name is Samson. I'm one of the FY2s. You can say FY2 because he's medical, he understands. Next, develop a rapport. Ask him maybe only one or two of these questions. Don't ask him too many questions. Certainly, do not ask all the three questions. Okay, just one of these is enough. What rotation are you doing? If it is clear, that is in pediatric or wherever he is, okay, then you don't have to ask. Okay, you can ask other things like how is your rotation going and how is your school? Okay, but don't ask too many questions. Introduce the topic. I understand you want to learn how to approach a suspected cancer. Is that correct? Yes. Or is that right? Yes. So is there anything specific you would like to learn about suspected cancer? Okay. Or you can simply say, okay, what do you know already about suspected cancer? So first we check on what he wants to learn. Is there anything specific he wants to learn in terms of suspected cancer? I want to learn everything, okay? And what do you know already so far? Yeah, what do you know already? Well, I don't know much, so which means he wants you to explain everything. So let's go. We're going to start by telling with the history. Well, look, to suspect a cancer, you have to take a good history. To suspect a cancer, you have to take a good history. Now, cancer may present in so many ways. And in most of the cases, the symptoms are non-specific. Okay, which means they are not specific for that particular cancer. Okay, the causes of that particular symptom, it could be many. Okay, and the initial presenting complaint depends on the location of the cancer, whether it's a lung cancer, bladder cancer, esophageal cancer, or bowel cancer. They may present with different symptoms, and they may present with non-specific symptoms. Patients with persistent and chronic symptoms are more likely to have a cancer. Symptoms that do not go away, a back pain that is not resolving, an abdominal pain that is not resolving, the constipation, the diarrhea that is not resolving. Persistent or chronic symptoms are more likely to be caused by a cancer. So you need to have a high suspicion index. What also can help you to pick up a cancer is doing a systemic review when you're seeing patients with persistent or chronic symptoms. Okay, that is asking the symptoms, respiratory, cardiovascular, GIT, genitourinary, CNS, musculoskeletal, that can help you to pick up and avoid missing a possibility of a cancer. So that is in terms of the history. It is also important to screen for other symptoms of cancer, non-specific symptoms, like, for example, the general symptoms of cancer. Cancers may present with loss of appetite, tiredness and fatigue, weight loss. These are non-specific symptoms, but if you're suspecting a cancer, you have to ask about this. The next, anemia symptoms. Cancer causes anemia. Ask about lightheadedness. Ask about shortness of breath. Ask about palpitations. Okay? Cancer commonly causes anemia. Yeah. Then the ideas, concerns, expectation. Some patients may have an idea. Some patients may have a worry, and they have reasons why they are worried. That can give you a clue. Ideas. Patient may be worried of a cancer, or patient not necessarily worried in here, because ideas, patient may have a thought to the cause. So it may have a thought to the cause of the problem. Okay, the cause of the problem. So is there anything you feel could be the cause of the problem? Or have you thought of anything that could be the cause of your problem? Okay. Concerns. Is there anything you are worried about? That's concerns now, yeah? It's different from there. That's concerns. Is there anything you are worried about? Yeah. They may have a reason why they are worried. For example, there may be a family history of a cancer, which may give you extra information and even take more detailed history. Okay, good. Then you come to examination. You have assessed examinations. Now, examining the patient, you might do a systemic review. Of course, you focus where you suspect the cancer is, but you might do a systemic examination. Okay, you might need to do a systemic examination to rule out what? Possible metastasis. Okay. The system we're suspecting, if it's GIT, bowel cancer, but also you're going to need maybe, spine examination for metastasis. So you might need, respiratory for lung metastasis. Okay, so you have to perform other systemic examinations, not limited only to one system. Good. Diagnosis. Okay. Now, when you suspect your cancer, you have to tell the patient the diagnosis. Okay, 1 second. Let's just come out from here. Yeah. And share the screen again. Then move forward. Good. So tell the patient that it could be simple things like infection. For example, suspecting lung cancer. The symptoms experiencing fever, shortness of breath, cough, could be simple things like infection, simple things like pneumonia, simple things like urinary tract infection, depending on the location. What other simple things can cause a similar problem? Okay, good. But then you have to tell them that you are worried and concerned. Yeah. So, but sometimes it could be caused by a much more serious condition. Okay. Sometimes it could be caused by a much more serious condition. And then you tell the patient that you are worried it could be caused by cancer of the lungs, cancer of the bladder, cancer of the food pipe, and so on. So what you try to do is to explain that I'm a little bit concerned. So try to use the word concerned. I'm a little bit concerned about your symptoms. Okay, because you have had blood in your urine. Okay, you have lost weight and you do smoke. Okay, now these symptoms could be caused by simple things like infection of the bladder. But sometimes, using the word sometimes, it could be caused by a much more serious condition. I'm concerned that your blood in the urine may be caused by, a cancer of the bladder. We didn't say you've got cancer of the bladder. We said, I'm concerned. I'm worried that your symptom could be caused by something more serious. In particular, I'm concerned it could be caused by cancer of the bladder. I'm worried that your symptoms could be caused by a much more serious condition, like a cancer of the food pipe or cancer of the gullet. I'm worried that your diarrhea or your constipation could be caused by much more serious condition. I'm concerned that it could be cancer of the bowel, cancer of the large bowel. Okay, your cough, your shortness of breath, your chest pain, could be caused by simple things like chest infection. But because you have lost weight, you're coughing out blood, I'm a little bit concerned that sometimes this could be caused by a much more serious condition. In particular, I am concerned about it could be cancer of the lungs. Okay, so that's how we explain things. We are not breaking the bad news now because it's not a confirmed diagnosis. We are only telling the patient what we are concerned about. So I am concerned because sometimes it can be caused by much more serious. What I'm worried about is that this type of symptoms, it could be caused by, prostate cancer, if it's the back pain, for example. Okay, so knowing how to explain the diagnosis is important, but the patient needs to know the diagnosis. Do not say, I do not want to scare the patient, so I didn't tell him the diagnosis. No, you should sensitively explain what you are concerned and worried about. Okay, don't say, I don't want to alarm the patient. That's not good. Patient needs to know, because once they understand what you as a doctor are worried of, they will understand why you're arranging other investigations. And because of this, you're going to now say, we need to arrange a colonoscopy to make sure we don't miss out anything serious. We need to arrange a CT scan of the chest. We need to arrange a chest X-ray. I need to refer you to a specialist. They will understand why you are taking that particular next step. Okay, so that's how you're going to teach a medical student. The next thing, okay, as we said, we're going to be sensitive and explain what we're concerned about, but we're not breaking the bad news. So don't use the breaking bad news approach of layers in here. You just have to use sensitive language to tell them what we are worried about. The next is management. We're going to say, so what I'll do, I'll be referring you to the cancer service. Okay, I'll make an agent referral for you using a suspected cancer pathway within 2 weeks. So which means you'll be seen within 2 weeks. Reassure the patient that not everybody who's being referred to a cancer service actually end up to be diagnosed with a cancer. You have to reassure them that. Okay, not everybody. Many people referred there are not diagnosed with a cancer. Explain that when they go to the appointment, they can take a friend, they can take a relative with them. Then it is also important to explain what will happen when they go to see the specialist. Okay, what will the specialist going to do? They'll do the same things. One, they'll ask you questions about your symptoms. Two, they will examine you. Okay. Three, they will perform specialist investigation. Some of the investigations that we may not do in the GP surgery. Yeah. So ask you questions, which is a history, examine you, okay, and do specialist investigation. Okay. So we're going to refer this particular patient today, but you'll be seen anytime within 2 weeks. We're going to do safety netting, that if you are not seen within 2 weeks or you don't get an appointment, you come back so we can chase up your appointment. It's important the patient is seen within 2 weeks. Okay. So once I refer you, how will I get an appointment? You get an appointment via the post. Okay. Get an appointment via the post. If you, for example, 1 week has passed, you don't get an appointment date, then you need to come back so we can chase it up. Okay. You should be seen within 2 weeks. Now, sometimes if you're in general practice, you might need to do some initial investigation before sending to a specialist. For example, you're suspecting lung cancer, you can arrange an agent chest X-ray. You're suspecting leukemia, an agent blood test that can be done within 24 hours or within 48 hours if you're suspecting, and then you refer after that investigations. But investigations generally should not delay referral to the specialist. Okay, what test you might need to do in primary care depends on the location of the cancer or the type of the cancer. Okay, so one more time, you have to explain what the specialist will do. What they're going to do: history, they'll ask you some questions. Investigation, they'll perform a specialist investigation. And of course, if it's confirmed, they will offer you treatment. Now, so what if it's a cancer, doctor? Patient may ask you, explain that if it is a cancer, in an unfortunate situation, if this is a cancer, then it depends on the stage. They may offer surgery, an operation to remove the cancer if it is treatable. If it's not treatable, they may offer palliative treatment such as chemotherapy or radiotherapy. Okay, so depending on, of course, the stage of the cancer. But as I said again, reassure the patient again. Not everybody being referred to the cancer service ends up to be diagnosed with a cancer. That is how you would teach a medical student. Thank you.